Welcome to another nursing mindset video. Today's nursing mindset is slow down before you speed up. As nurses, we're busy. Patients, they need medications. Providers, they're entering new orders. Call lights, they're going off everywhere. Family members, they have questions. And it's easy to feel like the faster you work, the better nurse you are. But when it comes to medication administration, the opposite is often true. The safest nurses aren't the fastest nurses. They're the nurses who know when to slow down. Because rushing is where mistakes happen. Think about the last time you were in a hurry. Maybe you grabbed the wrong item at the grocery store. Maybe you forgot your keys. Or maybe you drove somewhere and realized you didn't even remember the trip. Our brains naturally take shortcuts when we're rushed. Unfortunately, medication administration is not the place for shortcuts. Every medication deserves your full attention because every medication has the potential to help or harm a patient. So don't just make the medication your first priority. Now, this might sound strange, but before you think about the medication, you need to think about the patient. Instead of immediately reaching for the medication, pause and ask yourself, what do I need to know about this patient before I give this medication? Do I need to assess their blood pressure? Should I be checking a blood glucose? Do I need to review laboratory results? Is this medication still appropriate based on how the patient is presenting right now? Clinical judgment begins before the medication is administered. Learn to question what doesn't make sense. One of the biggest transitions from nursing student to professional nurse is learning that it's okay and it's expected to ask questions. If a dose seems unusually high, pause. If a medication doesn't match the patient's condition, pause. If something simply doesn't make sense, pause. Being a safe nurse doesn't mean you know every answer. It means you recognize when something deserves another look. Never assume that because an order exists, it must be correct. Your responsibility is to advocate for your patient by using your knowledge, your assessments, and your clinical judgment. The medication isn't the finish line. Sometimes students think medication administration ends once the patient swallows the pill or they receive the injection. But that's really just the beginning. Now your responsibility shifts to monitoring. So you ask yourself, what effect am I expecting? How long should it take? What side effects should I watch for? Could this patient experience an adverse reaction? Remember, medication administration is a complete process. Assess, administer safely, and evaluate the patient's response. Now, sometimes mistakes do happen, and mistakes are opportunities to improve. No nurse wants to make a medication error, but healthcare recognizes that errors often result from multiple factors, not just one person's actions. And so that's why we talk about just culture. If an error occurs, your first priority is always the patient. Assess the patient. Notify the provider. Report the error according to policy. Remember that incident reports aren't necessarily about just punishment, but they shouldn't be about punishment. They're about identifying system issues, learning from mistakes, and preventing future harm. Reporting errors and even near misses helps to improve care for the next patient. So here's the nursing mindset. When you're about to administer a medication, don't ask yourself, or don't just ask yourself, how quickly can I get this done? Instead ask, have I slowed down enough to make this safe? That one question can prevent countless medication errors because slowing down isn't wasting time, it's protecting your patient. So here's my final thought. As you continue learning safe medication administration, you'll discover that every medication follows the same safety principles. No matter what medication you're giving, take a moment to pause, assess the patient, think critically, question anything that doesn't make sense. Then administer the medication safely and evaluate the patient's response. Remember, the goal isn't simply to complete the medication pass. The goal is to provide safe, thoughtful, patient-centered care. Slow down. Think first. Administer safely. Because that's the nursing mindset. Keep developing yours.